a snapshot of the upcoming federal election. We're going to take a look at a snapshot of it. We'll talk about the roles of the provinces and the federal government in the context of healthcare, and then the importance of engaging your local candidates, and then reaching out to the new MPs, followed by questions. So let me start with this election snapshot from the CBC poll tracker. You'll notice that I'm not showing you the numbers that relate to what the parties are tracking at as political parties, because really those numbers aren't relevant to determining who's going to form the next government. What's most critical is the piece on the right there, probability of winning and forming a government. So those numbers were taken from a week ago, and let me give you the updated numbers. So probability of the Liberals winning majority has now declined to 30%. Probability of the Liberals winning a minority has climbed to 31%, so it's up 3%. Same with the Conservatives. Probability of them forming a minority has climbed to 29%. And then finally, the probability of the Conservatives winning majority government on the 21st of October have dropped to 9%. And we still have quite a ways to go, but those numbers are tracking, I think, pretty consistently. And also keep in mind this historical fact: since 1867, since Confederation, no federal Liberal government who has won a majority in their first mandate, like Trudeau did 4 years ago, went on to lose the next election. So historically, the Liberals will win the next election, this election coming up, whether it's a minority or majority government. The probability numbers are telling us exactly the same thing. They have a more than 50% probability, in fact, over 61% probability of forming the next government. And like I said, while a lot can happen between now and then, I think the numbers are looking, as I said, pretty consistent. So with that in mind, let's start with a review of who is responsible for what in our Canadian healthcare system. So in general, healthcare in Canada is publicly funded but privately delivered. You all know this. And it means that, in essence, the vast majority of healthcare services are free at the point of use, although they're delivered by private funders, or by private providers, like, for example, physicians. So the example someone once said to me to best illustrate this is when you go into a hospital and you're given a medication, for example, they don't say, well, before I give you the medication, you have to give me your credit card. Obviously, we all know it doesn't work that way. And that's what we sort of mean by free at the point of use. And also critically important, we all know that the provinces are constitutionally responsible for the administration and delivery of healthcare services under Section 92.7 of the Constitution Act of 1867, and the text in red is, of course, what is actually was in the original British North America Act of 1867. Those words were not changed in 1982 when the Constitution Act was updated. But as you can also see, of course, the term healthcare didn't exist in 1867. The territories are also responsible for the administration and delivery of healthcare services, although obviously not referred to in the 1867 legislation because they didn't exist. So the first critical point to note is that while you will hear all of the federal parties talk about healthcare, at least in part, in the context of the delivery of healthcare services, the truth is that with few exceptions, very few exceptions, they are not constitutionally responsible for the delivery of those services, and therefore actually, in actual point of fact, have little control over how they are in fact delivered within our system. So what is the federal role in the context of healthcare? Well, it's those 4 bullets on the slide there that you can see. What the federal government primarily does is fund healthcare services, not deliver healthcare services. They fund, but they don't deliver. Now, there are some exceptions. For example, they fund First Nations, veterans. They also fund 6 federal drug plans. For those of you who don't know, we have 19 publicly funded drug plans in this country, 10 provinces, 3 territories, and the federal government funds or is responsible for 6 public drug plans. They are Indigenous Services Canada, First Nations, and Inuit Health Branch, often referred to as NIHB, Non-Insured Health Benefits, Canadian Forces Drug Benefit Plan, Veterans Affairs Canada Treatment Benefits Program. Number 4, Royal Canadian Mounted Police Health Benefits Program, Citizen and Immigration Canada Federal Health Program, and then finally Correctional Service Canada Health Services. Other functions of the federal government within the context of healthcare include public health, although they share that with other jurisdictions, health protection programs, and health research. Again, it's worth emphasizing any candidate in this election who claims that if elected, they will do this or they will do that in the context of the delivery of healthcare is not giving you the full picture of how the system really operates. So then if the federal government has limited scope in terms of the delivery of healthcare, what is the Canada Health Act all about? Well, it's really just an insurance plan. That's what it is. It's an insurance plan with 2 critical elements to keep in mind. Number 1, it pertains only to what are called, and this is in quotes, insured healthcare services. Insured healthcare services. For example, those delivered in hospitals or by physicians, thereby leaving many of the clinical interventions and professional services that are integral to our current healthcare system not covered. Things like medications and home care. Second critical point to remember is that it is a leverage tool. It's a leverage tool that Ottawa uses with the provinces. So this is federal legislation. And so it simply says, in essence, if you, provinces, comply with the legislation, we will transfer you money for healthcare services and delivery. If you don't comply, we won't transfer you the money. So it's a leverage tool. So in essence, what the federal government can't do directly, deliver healthcare services to the majority of Canadians, they do indirectly by saying to the provinces, you deliver healthcare services in a certain manner or we'll stop providing you with the funds that you largely need to do your job. And make no mistake, they do need the funds. No province could operate its healthcare system without federal transfer payments. As you may know, there are 5 principles to the Canada Health Act, along with the requirement that Ottawa receive recognition for their role. Built into the legislation is a requirement that, and it's part of what the provinces are required to do. It's contingent upon them receiving money. And it's explicitly in the legislation. They have to, the provinces have to give recognition to the federal government that they have given them this funding. So their role within the context of the entire process. The 5 principles, again, as you may be aware, are public administration. So the health insurance plans must be administered and operated on a not-for-profit basis by a public authority responsible to the provincial and territorial governments. Comprehensiveness. The healthcare insurance plan must cover all insured health services provided by hospitals, medical practitioners. Universality, all insured persons must be covered for insured health services provided by the plan on uniform terms and conditions. That's the key phrase. Portability, which simply means that residents moving from one province or territory to another must have continuous and uninterrupted coverage. And then finally, accessibility. The insurance plan, the Canada Health Act, must provide for reasonable access to insured services by insured persons, again, on uniform terms and conditions. Now, if we move to the provinces and territories, you can see that this is where the delivery of health care really lies. The provinces and territories are responsible for the administration of their health insurance plans. So, for example, like in Ontario, OHIP, the Ontario Health Insurance Plan. Planning and funding of care in hospitals and other health facilities, services provided by physicians and other health professionals, meaning they regulate those health professionals, as you know, at the provincial level. Planning and promotion of health promotion, planning and implementation, of health promotion and public health initiatives. So you can see public health is shared between, actually not just the federal government, the provincial government, but even the municipal governments also have a hand in public health. And then finally, negotiation of fee schedules with health professionals in each province and territory is the responsibility of those provinces and territories. And then this slide is just to remind everyone how our healthcare system works as opposed to how it's often portrayed by candidates during an election. Healthcare delivery refers to the manner in which medical services are organized, managed, and provided. How they're organized, how they're managed, and then how they're provided to the public. In large measure, healthcare is delivered through private providers. Doctors are not employed by governments. They're self-employed, or they're employed by other entities, but not directly by the government in most cases. The health industry is the second largest employer in Canada, with actually now well over 2 million people. And they can be divided into three types of services that I'm sure most of you are familiar with. So you have primary services, so that's general practitioners, emergency services, those kinds of things. Secondary care, things like diagnostic testing, rehabilitation, and then additional care. Now, additional care is typically not covered by a health insurance plan, a provincial territorial health insurance plan, not covered by the Canada Health Act, and includes things like dental care and vision care. Now, when we turn to the funding of healthcare, of course, this is different. Healthcare financing refers to how medical services are paid for. And again, in large measure, healthcare is financed through public funds, but that's evolving. Total healthcare spending in Canada was expected to reach $242 billion in 2017, averaging over $6,600 per person. And financing comes from three primary sources. Public. 70% of all healthcare expenditures are made by the provinces and the territories and some federal. So well over 2/3, almost 3/4 of healthcare expenditures in this country are made by the state. Private, insurance through your place of employment, you purchase yourself, and of course it's often used to supplement secondary or additional care, which we talked about a moment ago. Out of pocket, increasingly being used by those with the means to purchase additional care. For example, the Provis Infusion Clinic in downtown Toronto, where if you want to get infused with certain oncology medications, you can go there, you can pay. This is something that no candidate for office will ever talk about. You're not going to hear candidates in this election or in any provincial election talk about how, particularly at the provincial level, they have set up and enabled out-of-pocket institutions or care to develop in our system such that those who can pay for it can go and get it, because of course it's quite antithetical to how we think of our healthcare system, or the perception that politicians have a vested interest in protecting about what our healthcare system is all about. Now, let's shift gears and talk about how to develop some key messages that will allow you to advocate to candidates for office in this election. Politicians as a group tend to know a little bit about a number of different things, and that's not a criticism, it's an accurate reflection of them and their jobs. And they're required to deal with many different issues every day. This requires you as an advocate to simplify as much as possible the issues that you put before them. But I'm not talking about dumbing it down. I'm talking about conveying the core elements in a compact manner. You need to be able to convey to particularly a candidate for an election the core elements of what you need them to know in a very, very compact manner. When we talk about framing your key messages, we talk about your three key messages, and having three key messages that explain the salient points in very simple language of what it is that you want the decision maker, or the candidate in this case, to know. Each key message ideally is 25 words or less, and we always talk about them being clear, compelling, concise, and consistent. And if you look at those 4 words very carefully, you'll see that any key message that adheres to that will be very focused and very well received. Your 3 key messages should tell a self-contained story. There should be a flow to them. In other words, they're not just 3 random statements. They should flow together. And they'll be unique to your issues and to your circumstances. Here's a model for developing key messages. It's just one model. It's not the model, but it's one that we use quite often and we think is quite effective. And when trying to determine what you want to say about your issue, it's a good one to use. So the first key message is really what we call the hook. It's the one that draws the listener into your story, what it is that you're trying to talk about here. The second key message is meant to keep them engaged. The first indication that there's something that they can do to help you should come through in this second key message. And then the third key message connects to your ask, which we'll talk about in a moment. So if you go to the worksheet that we've provided, you can see here that we go through this in a little bit more detail. On the first page of the worksheet, we talk about what I just mentioned before: identification, framing, and then the model of the 1, 2, 3 key messages. You can see that there. I obviously won't reiterate it. Excuse me. But if you go to the second page, there's a worksheet there that allows you to develop your own key messages and be able to populate this yourself around a particular issue. So your first key message should essentially answer the question: what is the problem? What is the issue? Why are we here? Why are you talking to me? What is it what's the issue here? So you try to capture that, again, 25 words or less in the context of your first key message. And then on the right, you have to come up with some supporting points. Now, this is important to remember. Your key messages are not just a bunch of facts. That's a different thing. Those are facts. Your key messages are meant to be subjective. You're meant to use language that draws the listener into seeing the issue the way you want them to see it. However, even though it's subjective, it has to be underpinned with facts. It has to be underpinned with things that you can prove and that are indeed true. So when we talk about supporting points, we talk about, all right, if you're going to make an assertion through your first key message, what proof do you have that this assertion is in fact accurate or true? So those are your supporting points. The second key message is, what is the impact of the problem? I call it the sort of what's the big deal message. And this is where, so, okay, you told them there's a problem in your first key message. Well, okay, so what sort of thing? You've told me there's a problem, but what's the impact of the problem? Why should I care, quite frankly, that you've told me about this problem? And so you have to be able to demonstrate in the key message, we always suggest, that what is the impact of the problem? Why is it a big deal kind of thing? And why am I speaking to you about this at this time? Again, with some supporting points. And then finally, the third key message is the solution. So what would it look like if we solved, or in some cases didn't solve, the problem? Now, I would suggest that you always try to err on the side of something positive. What would it look like if we solved the problem? How would things be better? Governments don't tend to react as well when you say, and if you don't do this, the sky is going to fall. Because, of course, the sky doesn't fall. So try not to end on a negative note. Sometimes we do. Sometimes we actually have to, depending on the circumstances. But it's always better to end on a positive note. What would it look like if we solved the problem? How would things be improved? And this is also known as the sort of call to action, if you will, which again bridges to your ask, which I'll get to momentarily. So as it says on the worksheet there, once you've developed your key messages, practice them. We have some tick box there for you to go through to make sure that you sort of captured everything. And we found this two-pager to be really useful for people and for organizations who are looking to do this kind of work. Again, certainly the same thing in the context of an election. And finally, the last step, your one ask, because you're going to ask for the one thing you need and not a list of what you want. Let me say that again because it's very important, as it says on the slide, because you're going to ask for the one thing you need and not a list of what you want. As I always say to people, advocacy is not Christmas. It's not a chance to ask for everything you've ever wanted. It's a chance for you to ask for the one thing that you need, especially when you're advocating to government. If you ask for everything, you will get nothing. You need to stay focused on that one thing you need, even though you may need more than one thing. That's not my argument. You might need 5 number one things, but you have to ask for them one at a time. So this is a case where less is definitely more. Next, your ask needs to be tangible. It needs to be a thing. So asking for support is not an ask. Asking for help is not an ask. Asking for a commitment is not an ask, because those aren't real things. They're words. They're words that politicians make a living conveying, but they're not an ask because they're not a tangible thing. An ask is when you say, I need you to write a letter to the Minister of Health saying the following 3 things. That's an ask because the letter is tangible. You can see it. You can print it off. You can feel it. It's a real thing. Now, having said all of that about your one ask, I'm now going to turn around and tell you that during an election, delivering and securing one tangible ask is not the formula that we use. I'll explain why in a moment, but we'll come back to this idea of the one ask when we talk about the post-election strategy. So while I don't want to move away from the importance of having one ask, this is absolutely critical in advocacy. It's the whole reason we do this work. It's a little bit different in the context of an election, which, as I said, I'll circle back to. So here are 5 things that you, or in some cases your organization, can do to advocate to candidates during the current election. And there are more, but these are sort of the 5 that I've come up with that I think are the most feasible for most individuals to do. Because these people are not yet in positions of power, asking them to do something tangible is not really realistic because they're not there yet. Instead, your focus should be on 3 things. Number 1, introducing yourself and your organization and starting to build a relationship. And always remember that sometimes people who lose an election come back and win again. In fact, in the last provincial election, we saw a bunch of people who had been MPPs who lost, who are now MPPs again. So the value of building a relationship with all of the candidates should not be really questioned, in the sense that they often come back and will end up either running again and in some cases, of course, winning again. Second reason is starting to familiarize them with your issues, largely by delivering your key messages. It's an opportunity for them to start to understand who you are and who your issues are, or what your issues are, excuse me. And again, you deliver, and you do that primarily by delivering your 3 key messages. And then finally, it's important because it's about setting the stage to return to the person who wins, who will then be in a position to do something for you. So one of them is going to win. You know that. We all know that. So it's just a way to sort of do an introduction before they actually can do something that will be helpful to you, tangibly helpful to you. Take the time to read the party platforms as they relate to healthcare. If in fact healthcare is what's critical to you, if it's another issue, then you should take the time to read the party platforms as it relates to that. By the way, I'm showing you these ones by virtue of illustration, just for the Liberals, Conservatives, and Democrats. This information is online for the other parties that are running as well. You'll notice that they're all about money. When you read these three statements carefully, by the way, these are summary statements, I should tell you. You'll notice that they're about money. Well, most of the promises are connected to the delivery of healthcare. So we're back to what we talked about earlier. They love to promise, for example, the Liberals around home care. The Conservatives are going to have more MRI machines. And the NDP are going to have pharmacare for all. Those are all connected to the delivery of healthcare. And yet, as we talked about, the federal government doesn't deliver healthcare. They fund the provinces to deliver healthcare. So these statements are ironic that in one sense they're all about money. You can see money and the theme of money running throughout all three of them. They then connect those statements about money to promises about delivery of healthcare, which again is not something that they can directly do at all in our system. Attending an all candidates meeting. This is a forum to hear what local candidates have to say about the issues, and again, it's an opportunity to introduce yourself and to deliver your three key messages. It's also a potential chance for you to ask a question of one or more of the candidates, again, about an issue that matters to you. And also, don't forget, you may be able to interact with the local media. Local media always attends local all candidates meetings, so keep in mind, if you're going to go and you're going to ask a question or you're going to sort of put yourself out there, then you may be approached by the media, or you could approach the local media to try to further, to get further attention publicly for your issue. And of course, it's always an opportunity to use social media, highlight your impressions. So a lot of times people will live tweet from all candidates meetings, or they'll go home from an all candidates meeting and they'll post a summary of their impressions on Facebook or some other social media platform, and that can be a really effective way of also capturing your impressions of what you saw. Next, talking to candidates at the door. Now, I put this rather old photo of people canvassing during an election. I think it's from the 1950s or early 60s. Because you might think that it's an outdated practice, but it's actually not. Door-to-door canvassing remains the primary method for local candidates to meet the voters during an election. The problem is most voters aren't prepared to meet their candidates. So if you want to be prepared, here are some ideas. Print out your key messages on a piece of paper and keep them near your front door. Practice delivering them so that you'll be ready. Write down their response to your issue. If they do come to the door and you deliver them, try to capture what they say. What's their response to what it is that you have to say, good, bad, or otherwise. You should ask to take a photo with the candidate and share it on social media, because again, it's an opportunity to highlight your engagement. And also, don't forget to include a brief summary of your discussion. Don't just post a photo, but tell people what it is that you engaged around. And then also ask if you could follow up with further comments or questions, not necessarily during the election, but certainly you could say, look, if you're elected, I'd really like to come and meet with you again to talk further about this. Would that be okay? And I can guarantee you 100% of the time, they're going to say, oh, yes, of course, that would be fine. So it's something that if you don't ask, then you don't have that assurance. Then, of course, if they are elected, you can go back and say, oh, remember, we had this engagement at my door, and that kind of thing. Questions to candidates or parties. Drafting and delivering questions to the federal parties, their leaders, and or local candidates is a very common advocacy activity by organizations during an election. And CCSN is doing exactly that, asking 4 questions of candidates during this election that cover employment insurance sickness benefits, national pharmacare, youth vaping, and breast cancer screening. We won't take the time to review all of them in detail, but here's a sample of one on national pharmacare. So it's the second question that CCSN is posing to the parties and to the candidates. And this is the preamble. This is sort of the setup, this text. I won't read it to you, but this is the text that is the setup to the perspective that CCSN is bringing to the discussion and to the debate around national pharmacare. So you'll notice that they've highlighted some key elements within here and really sort of framed up how they want the candidates and the parties to see this issue from their perspective. So then they ask two questions based on that preamble. And they would like the various candidates to answer these two questions. The first one, what is your party's position based on what we would like to see in a national pharmacare program? So the preamble sets up what CCSN would like to see. And then the first question is, what's your party's position on this from our perspective? And then number two, will you support a new federal equalization payment to the provinces? Is that something that you would commit to in the context of being a candidate for election? So this is a perfect sort of way to do this kind of work. Set it up through the preamble, you give your perspective, and then you lead them into two questions, the position and then support, to sort of round all of this out. And again, you'll notice that there's nothing wrong with talking about things like support at this stage because they're not in positions of power. They can't give you something tangible. And the final tactic that we use is the idea of what we call pledges, candidates signing pledges. Now, these, they're not often used in Canada. They're actually much more popular in Europe. Not just during European elections, but even just in general, engaging European politicians. But we think it's still an effective activity that can be used by groups during elections. So here's an example of one that we actually used in the last Ontario provincial election. And you'll notice that the action term we use is actively engage. There are 4 bullets there that we ask the candidates to pledge to. And each one starts with the words, you know, I hereby pledge to actively engage to, and then do something. Those words, actively engage, were chosen so that Family Service Ontario could go back to the people that were elected and sign the pledge to request, essentially, we now need you to actively engage as you pledged by taking the following tangible actions. So think of this pledge form as a bridge that they used with candidates who could not do something tangibly, but by committing to actively engage, they then, Family Service Ontario then seeks to turn around and make that commitment to actively engage into something tangible, a tangible sort of action. And then finally, this is the last slide, the importance of reaching out to new MPs. Obviously, when I talk about new MPs, whether they have been re-elected or they are brand new to the job, they are still new within the context of the next Parliament. And so it's critically important that you follow up with them as quickly as possible, particularly if you've done work that has laid the groundwork for that kind of activity during the election. So here are some ideas of things that you can do actually even before they're necessarily sworn in as an MP. You can use pre-drafted social media content to congratulate your local winner on election night. You can send a letter of congratulations to your new MP shortly after Election Day, ideally asking for a meeting. So again, to get in there and to talk more tangibly about your issues and what you need them to do now that they are in a position to do it. Follow up on the questions, for example, the ones that we saw from CCSN, or pledges, or any other interaction that you may have had during the election period. Refine your one ask to now be tangible. This is critically important. You have to change your ask to something that is tangible, that they can now fulfill now that they're in a position to be able to do so. And the example I give there is the one I talked about before, sending a letter. Look for opportunities to bring value to the relationship with your MP. This is a very well-known but not often enough used, in my opinion, tactic in advocacy, any kind of advocacy. When you're building a relationship with somebody, the person who has the thing that you need, decision maker in this case, try to bring value to them. And one of the things we talk about in terms of value is information. And that information could take the form of materials, other things, being a conduit or a liaison in the context of a role that you may play in the community or with your organization, community events, attending community events or helping to organize an event if that's appropriate with your new MPP, particularly one that's brand new to the job, to be able to, in essence, introduce her to your constituency is a very powerful tool and something that she will not forget in the context of a relationship building exercise. And then ideally, you really want to establish a sustained dialogue. You really want to be able to build a relationship, have the MPP understand who you are, what's important to you, what you need them to do, what your issues are, who you represent, and agree to meet on ideally a regular basis in person. And a regular basis could mean twice a year, could mean more depending on what the issue is and what you're working towards, but 2 face-to-face meetings a year around an issue that is important to you and also important to your MP. It has to be something that they're connected to and working on with you, is not an unreasonable request. And so that's why a sustained dialogue is really ultimately where you want to go in the context of being able to meet with these newly elected members of Parliament. And that's it. I appreciate your attention.
Thank you, Ryan. If anyone has any questions, you're welcome to type them in the panel to your right now, and Ryan will address them. We'll give you a couple of minutes to do that. For those of you asking if the presentation will be available to participants, yes, the recording will be going up on CCSN's YouTube page tomorrow, as well as SlideShare, and everyone registered for the webinar will receive a file with that as well. Okay, Ryan, we have a question here. Can you advise me on how to repeal an existing law? Any thoughts on that, Ryan?
Sure. Well, first of all, you have to wait until the new government is in place, irrespective of who they are. And then you'd have to go to the government, ideally to your MP, and have a discussion about why it is that you want the law repealed. It will also be very important to understand as well that is it a law like in the strictest sense of the term, is it a law as in like something passed by the legislature, the House of Commons? Is it a regulation that appends to a law, which is a bit different? The regulations are passed by cabinet, not by the House of Commons. Or is it a policy? Policy is something that brings the regulations to life further, and policies are typically developed by bureaucrats, not by politicians. So, and those are the sort of the three levels, if you will. So, if it is in fact a law, and it's passed through the legislature, then you would have to go to your MP and begin the discussion about why you think it needs to be repealed. Does it need to be repealed and replaced, or just repealed? And then you would have to essentially convince the party in power, majority or minority, to agree to repeal the law. Again, you could do that through your MP. If your MP is an opposition MP and they're not part of the government, like let's say it's a majority government and they have no real sway in that context, then you're going to have to find an MP on the government side to be able to work with. Now, interestingly, if it's a minority government, you may be able to work with one of the opposition parties who is supporting the government, the minority government, to have that repealed, depending on what it is. But all that to say, you're going to have to work through, I think it starts with working through an individual or a local MP, and then you have to elevate it from there. You'd have to start to meet with, in this case, the minister's office, whose ministry is responsible for the legislation, the prime minister's office, who ultimately would agree or, to repeal it, and why. There's a number of steps that you'd have to take, and it can be quite complex and time consuming, but I think that's probably how you would get started.
Great, thanks, Ryan. We have another question. What about using a private member's bill? Then it doesn't matter whether they belong to the party in power?
Yeah, private members' bills can also be used. Private members' bills don't often succeed depending on the circumstances. So just to break this down a bit. So if it's a private member's bill from a member of the government caucus, let's say it's a majority government, just to keep things simple, and the government agrees with what the private member, one of their caucus members, is trying to do, then there's a high probability that that private member's bill will pass. Remember, though, there are restrictions on what private members' bills can address. A private member can't write a budget bill, for example. There are restrictions on the content that a private member's bill can contain. If it's an opposition member writing a private member's bill, unless the government agrees to pass it, again, assuming it's a majority, it's not going to pass. However, private members' bills can be very effective at highlighting something that you want to highlight and to ultimately end up bringing change. So, in other words, we use private members' bills, typically ones drafted by opposition members in particular, to start to leverage the conversation around the need to change existing legislation. And so it serves as a point of initiating something, not as the actual lever to make the change, if you understand what I mean. But it is opposition, well, any private member's bill is often a very worthwhile exercise in that context to get something going.
Thanks, Ryan. Just one last question here, being mindful of time. This asker asks, thanks for the presentation, Ryan. You often spoke about discussing issues with your local MP. However, as a member of a national organization, we must manage multiple MPs across different party lines when thinking about our ask. How do you suggest we best approach issues where constituency/patients are affected across multiple jurisdictions?
Well, it's really not any different in the sense that you want to engage all MPs, irrespective of what party they belong to, and so you have to some extent, perhaps tailor how you approach them, given where they're at. But it doesn't really change anything. You still approach them with an ask, meaning something that they can do that is tangible. Now, again, where it gets interesting is whether it's a majority or a minority. If it is a majority government, the general rule is that in the first 2 years of a mandate, the opposition members are really not terribly relevant. And when I say not relevant, I don't mean irrelevant. I mean not relevant in the context of being able to bring about tangible change, because they can't compel the government to do much of anything. Now, it doesn't mean you still don't engage them. But in that situation, and I hope this answers your question in part, you would want to put more emphasis on those members that you have that are in government ridings, where the MPs are members of the governing party, as opposed to the opposition. I'm doing one right now, and we've tiered the work. This is in Ontario, where we have a majority government. The first tier of MPPs, in this case we're going to target, are government members, and we're targeting them because there's a majority government, and it's the first half of a mandate. The second tier are opposition members. However, if it's a minority government, depending on the composition of the minority government, all MPs, who are part of supporting the government could be equally as important. And so you might have a situation where, assume that the Liberals win a minority government, which is what the probability is as of today. Of course, you're going to target all of the Liberal MPs, but if they are supported, for example, by both the NDP and the Green Party, those MPs suddenly become just as important. And so you're going to absolutely want to target them. But the Conservative MPs may be somewhat less important. But having said that, you have to be careful because it's a minority government, and if it falls, then the Conservatives could come back and win the next time. So minority governments, generally in a minority government, we target all the MPs equally as much as possible because we never know what's going to happen. But in a majority government, in the first 2 years, you spend most of your time focusing on the governing MPs and not the opposition MPs. I hope that helps to answer your question.
Great, thanks, Ryan. If anyone else has any questions, Ryan's information is up on the screen right now. I'm sure he would be happy to answer questions by email, or you can direct them to myself at communications@survivornet.ca. So that concludes today's webinar.